There are many decisions you will make when you have chronic illness. If you are sick enough to come to the hospital, you will be asked if you would prefer to have cardiopulmonary resuscitation. Cardiopulmonary resuscitation is commonly called CPR. Most people know CPR as the emergency help someone can be given if their heart stops and they collapse on the street. It is also the name given to the treatment that can be given if someone's heart stops while they are in hospital. CPR was first tried on well people who unexpectedly had their heart stop beating. This is now offered to many people in the acute care hospital as well. When the heart stops and it doesn't restart again in a couple of minutes, the person dies. In many cases, this is a natural and expected event at the end of an illness. When patients choose not to have CPR, treatment is still focused on helping you live as well as you can for as long as you can. You will always receive treatment to help you with symptoms such as pain and shortness of breath, and care for your needs. Even though your health may be good right now, it is good to talk about whether you prefer CPR to be a possible option in your care. To help you make a decision about whether or not you should receive CPR, we will explain what CPR is, how it is done, what could happen, and whether or not it is effective.
Okay, but I still want to come back.
When a person's heart stops beating, that person becomes unconscious within a few seconds because there is not enough blood going to the brain. During this time, the person is not aware of what is happening and does not experience pain. A team of specially trained doctors, nurses, and other professionals provide CPR in the hospital. CPR can include pressing hard and fast on the breastbone to pump blood through the heart to the body, pushing air into the lungs to get oxygen to the brain, putting a breathing tube through the mouth into the lungs to get air into the lungs more easily, giving medications to try and restart the heart,
Okay, clear, everybody.
using electric shock to try and restart the heart. If the heart is restarted, the person then needs special care and is moved to the intensive care unit. The person will need a machine to help with breathing, medicines, and fluids while trying to recover. This is called being put on life support. People who survive CPR usually need more medicines and treatments before they may be well enough to leave hospital. How well CPR works depends on the person's medical condition at the time the heart stops. Studies show that overall, 18 out of 100 people who undergo CPR in hospital survive and are able to leave the hospital. This means that 82 out of 100 people will die shortly after their cardiac arrest. People who come to hospital with more severe diseases are less likely to recover after receiving CPR. For example, people with serious chronic diseases like cancer or heart and kidney disease. Only 10 people like this will survive. This means that 90 patients will die. Older people with advanced disease of any kind are more likely to die if their heart stops. Only 6 people like this will survive. This means that 94 older patients will die. CPR does not improve the illness that caused the heart to stop in the first place. CPR, at best, returns the person to how they were before the heart stopped. Some people do not return to the life they had before this event. Although 13 of the 18 people who survive will return to their home, about 5 of the 18 people who survive are discharged to another setting, like a rehabilitation center or nursing home. People who had no thinking problems before the cardiac arrest are usually able to think and communicate well afterwards. 15 of 18 people can think and communicate well, but 3 of the 18 survivors will have serious problems with their ability to think. Some people worry if they say no CPR, that they will not receive any care at all. This is not true. What you decide about CPR does not change how we care for you. You can still receive treatment to control and improve your illness. This could include antibiotics, intravenous fluids, or other medical treatments. You will be offered treatments to help manage symptoms such as pain and shortness of breath, and support to meet other needs. We want to help you live as well as you can for as long as you can. Saying no CPR means that when the end of your life comes, we will treat you with dignity and support your family and friends. We will continue to talk with you regularly about your health care. There will be other decisions that need to be discussed as part of your care. We do not expect you to make difficult medical decisions on your own. Talk with your family, friends, and your healthcare team about your thoughts, concerns, and wishes. Your family and friends need to understand what is most important to you in case they have to decide about your health, should you become too sick to speak for yourself.